Everyone had their favorite study. If you wanted to give steroids, you liked the ANAN study. If you didn't want to give steroids, you liked the corticosteroid study. So then people said, enough is enough. We need some bigger, more definitive trials. The French did another much bigger study called APROCCHSS, and it was published in the New England Journal of Medicine. And yet again, in their hands, they knocked it out of the park with a big improvement in mortality. Meanwhile, the Australians ran the trial called ADRENAL with several thousand patients, also published in the New England. No benefit. People have then tried to find within ADRENAL the subset of patients that looked like the patients that were in APROCCHSS to see, is there at least some suggestion? But thus far, no one can find within the ADRENAL trial a subset that looked like APROCCHSS who then have a similar effect to APROCCHSS. So people are confused. Along the way, the French also did another trial called CAPE COD that looked quite like the APROCCHSS trial, only it was just in pneumonia. And there too, they found most of the signal in APROCCHSS appeared to be in the pneumonia patients. CAPE COD was positive, APROCCHSS was positive, and APROCCHSS was most positive within the patients that had sepsis and pneumonia. So if there was only the French literature, you would give steroids broadly to hospitalized pneumonia, broadly to sepsis, and you would expect the largest benefit in the patients who had sepsis due to pneumonia. But the problem is we cannot generate an evidence base outside France that goes in the same direction.